Good morning, everybody. I would like to talk about patient behavior-guided nursing in neonatal intensive care unit. I'm Judit Varga and work as a neonatologist in the second department of obstetrics and gynecology. My supervisors are Professor Miklós Szabó and Rita Nagy, and we work with Zoltán Sípos together. And we have the vision that sleep protective nursing of neonates leads to a better neurodevelopmental outcome and better quality of life. And we try to develop new techniques of automated detection of circadian rhythm and behavior of premature infants and neonates. And to achieve our goals, we have two ongoing projects. In our first project, we deal with already existing systems, and we try to determine the accuracy of a sleep measurement tool called actigraphy in children. And in our second project, we try to make a new device, a camera-based observation of behavior of infants in neonatal intensive care unit. Let me introduce our first topic, the diagnostic accuracy of actigraphy compared to polysomnography in children. According to pediatric sleep research, the prevalence of sleep disorder is very high in children, and it is extremely high, we can say, in children with neurodevelopmental disorders, and this may worsen further development. But how to measure objectively sleep? This is very important because sleep pattern is essential to improve the sleep comfort and to measure effectiveness of different interventions. The gold standard of sleep measurement is polysomnography, which is, however, a very complicated procedure with lots of wires and machines attached to the patient, and requires huge hospital resources. There exists, however, another device called actigraphy, which is cheap and easy to use and makes long-term measurement possible. Even at home, you can wear it on your wrist. So our aim is to get answer to the clinical questions that does the accuracy of this easy-to-use actigraphy reach the accuracy of polysomnography in children population. We plan to do subgroup analysis and with the statistical analysis of sensitivity, specificity, and accuracy, we try to get the answer to the question. As easy to use the tool as high the chance to introduce into the clinical practice. So, for example, for guiding nursing periods based on the actual sleep state of our patient. The systematic search was carried out in these databases in November according to this search key. And the selection, we are working on the selection, as you can see on the flow chart. And let me introduce our second project, in which we are having our first steps in developing a camera-based observation of behavior of infants in neonatal intensive care unit. This project evolves from a previous project, which was about video-based vital sign monitoring, and this means that a simple camera can tell you the vital signs of a person, so the heart rate and even saturation and respiratory rate. And why not to use this camera for other measurements like sleep and behavior? There have been in the past many attempts for sleep measurements in neonates and premature infants because it's essential in this early period of life. Polysomnography was used, behavior scales were made up, amplitude integrated EEG and actigraphy was used, and in the latest time, even video-based observation. And this is an excellent tool because it integrates the different types of data. It measures parallelly vital signs and visual parameters, movements and colors, and also non-contact, which is also very important for our fragile patients. And this will be a long project, but in the first phase, we would like to collect data for labeling and teaching the machine learning system which is connected to this system, this video. And with this, the development of video-based device to automatically recognize the different behavior patterns of newborn infants in our intensive care unit. And we collect data parallelly with the video system and by direct patient observation and also casual contact monitors. And the outcome is the video recognition of the 5 behavior patterns according to a program called Newborn Individualized Developmental Care, which is deep sleep, active sleep, drowsy, quiet awake, and active awake. And these information we would like to use for making possible individual monitoring of circadian rhythm and individual care, which would make a better life, not only in the early period of life, but also later when these premature babies grow up, because we believe that this would result in a better neurodevelopmental outcome. So the inputs for the machine learning system would be the data collected with the video system and the vital sign parameters and also movement patterns, and parallelly with direct patient observation and conventional monitors. And first we would like to teach for this system how to recognize the deep sleep phase. And to sum up once again the 2 projects with the planned submission date. Thank you for your attention. Please don't hesitate to ask questions, and don't remember that everything is theoretically impossible until it is done.
Thank you very much. You have an amazing topic here. I have a question regarding your first study of the meta-analysis regarding the polysomnography and actigraphy. Are these 2 methods comparable in all the manners? I mean, as I know, polysomnography can be used to diagnose sleep disorders, but can we record all the data with the actigraphy that is enough to diagnose sleep disorders?
Yes, there have been many studies in adults to compare the 2 systems, and it matches. But in pediatric population, this information we don't have yet, so that's why we would like to.
And who will analyze this video monitoring, the results? How will be statistically or scientifically evaluate?
I think that we will have more phases. In the first phase, we will see if it is possible to teach this supervised system by labeling the.
But the doctor, you, or who make the analysis? 1 person, 2 persons, independently. Because it's not so easy for me to analyze even this 5 phase you mentioned.
Yeah,
so
that's why we have chosen only 1 phase first, the deep sleep phase.
Yeah.
And yes, with
and
the
who will analyze?
Me and the physicians, and we will see.
Only 1 for each case, or 2 independently?
2 person.
Because I think in this case at least two independent persons should analyze. Otherwise, it can be quite subjective.
Validation will be a further aim. Yes.
Okay.
Maybe provocative, maybe I'm just too, innocent on this. So in the first study, you compare actually two methods, trying to say that actigraphy is as good as polysomnography, but that is cheap and can be done at home, okay, even at home. So probably this is something, I don't know how is that. That would have been good to say something about that method, because that is probably, you don't need a specialist, to actually get the data. Now in your second study, actually you propose to use both. If actigraphy is as good as the other method, so why to use that? Why to use both?
Yes, but actigraphy would give information only about sleep, but it is not sure that, for example, in neonatal group, it is accurate. But this video system, we would gather many information about environmental circumstances also, and different events, nursing events, for example, and the circadian rhythm would be analyzed more complex.
I've got a very short question. Congratulations on both on your projects. The second one is rather just a practical question. So I'm not an expert of sleeping, but significant light can disrupt or disturb sleeping pattern. And so you're doing a camera recording of the patient, so you need some light. How can you deal with that problem? Or what kind of standardization of the lighting of these little patients need, and how does that influence the sleep pattern itself?
Yes, the physicians promise that it will work also in dark, and this can also be an aim, for example, to measure the light circumstances during the day, and how light changes in a 40-hour period, and how it changes the circadian rhythm. So it is also a question.
Thank you.